My name's Nirmol Philip, and I'm an infectious disease doctor with the Medical Specialists of St. Luke's. I pursued my undergraduate degree at UCLA, where I studied molecular biology and English literature. My interest in public health and medicine has always been there, so I decided to go to the Maxwell School at Syracuse University and pursue a degree in international relations. My studies there took me to the CDC, where I worked in the Global AIDS program. I pursued a medical degree at Tulane, where I also got my master's in public health. From there, I did residency at Christiana Healthcare Systems in Newark, Delaware, and infectious disease fellowship at Temple University in Philadelphia. What I love about infectious disease is that often infections are very treatable and often curable. We all know, beginning in childhood, the relief that can come with an appropriately prescribed dose of antibiotics, and that, as a clinician, is very gratifying to me. The world of infectious disease is very exciting. Think of vaccines and how they've been able to eradicate or nearly eradicate many of the world's diseases. HIV today might mean taking one pill every day for the rest of your life. You think of Hep C, which is now a curable condition. As an infectious disease doctor, I think it's very important to be a good listener, because a small detail a patient shares could be the key to unlocking a diagnosis. Additionally, I think it's really important to communicate in a way that facilitates a patient's understanding about his or her condition and treatment, so they can be an active participant in the healing process. And finally, the internet can be a scary and dangerous place sometimes, so part of my job is to provide patients with information that is evidence-based and given in the context of my best clinical judgment. I like to think I'm approachable, easy to talk to, a good listener, and I like to believe that my patients believe that if I don't know something, I will be honest with them, and I will try to get the information that's necessary to make a good decision for their health. Infectious disease is what attracted me to go into medicine. I was working in the Center for Disease Control's Global AIDS program as part of a larger U.S. initiative that since 2013 has saved over 17 million lives. I was working with clinician scientists and public health experts who were bringing treatment to people who otherwise were struck with a medical condition without hope. There are many challenges in the world of infectious disease, like the rise of antimicrobial resistance. There are infections that are increasingly difficult to treat, like C. diff. And then there are those infections that we haven't even heard of that pose a threat to the future. I do play the spoons. I was taught by an officer in the Royal British Army, and all I need are 2 spoons. I also had a one-hit wonder with my 2 younger sisters. I played the piano. My sister plays the electric guitar, and my other sister accompanied me on the piano. My name's Pearl. My sisters are Ruby and Golden. We were known as Perugo, and yeah, emphasis on the one-hit wonder.